4:01 and calling this meeting of the Adams Board of Health to order, November 17th, 2021. I'd like to note that there is a waiver. I don't think anybody is coming in remotely, but virtual participation of this meeting is allowed by Chapter 20 of the Act of 2021 suspending certain provisions. For the open meeting law, as general law, Chapter 30, Section 20, the Zoom information is given below. This meeting is being recorded. I should ask, is Brian, are you recording?
Yes, I am. I'm recording audio.
If anybody else is recording, please let us know. And if anybody is having trouble, my phone number is on the agenda so that they could call in. They open the meeting. Please observe a moment of silence for Starry, the Yanka, who lost his life recently. He was one of the nicest people I've met here in Berkshire County. I knew him mostly from the transfer station where he served as attendant for a few years. Steve always kept his eyes out for seniors to unload their household waste and recycling for them. Many will miss Stubbery. Before we get into the real agenda, I do want to report on the outcome of an emergency situation, which turned out not to be hazardous, but there was discharge, especially minerals. It was reported to Mass DEP yesterday, and there has been several agencies and so forth investigating. There is a statement which has been crafted. I will just read it. So regarding the SMI incident, at the request of Adams Town Administrator Jay Green, the Northern Berkshire Regional Emergency Planning Committee, along with several other planning and response representatives from Adams, North Adams, and MEMA, reported to the Adams Town Hall this morning in response to the changing color of the Hoosic River. The following is what we know at this time, and we wish to thank the many individuals that brought this event to our attention. On November 16, 2021, Mass DEP received notification of a release that had occurred to Hoosic River and Adams, and that the river was turning white. This was directly reported by staff at Specialty Minerals as part of their response plan. Mass DEP responded to the scene and confirmed that the source was from Specialty Minerals. It is reported that Specialty Minerals stated that they had a process upset and immediately upon being discovered, they shut down their operation until their settling ponds had cleared and treatment could meet their permit limits. Mass DEP reported that the white color is likely sediment and solids associated with the manufacturing of precipitated calcium carbonate being discharged in SMI's effluent. They also report they collected samples that were analyzed for pH, acidity that is, and solids indicated that there is no harm to humans and that the release is not toxic and it is inert. Mass DEP tracked the white discoloration to the Vermont state line before dark yesterday and returned to the river early this morning. They continue to make observations in conjunction with Mass Fish and Wildlife and the National Heritage and Endangered Species Program to assess the impact to the habitat and ecosystem, including looking for potential fish kills. Mass DEP has ordered SMI not to operate until it can assure that it will meet the discharge permit requirements and to provide a detailed incident to Mass DEP. DEP stated that they have notified authorities in North Adams, Williamstown, Vermont, New York, and the Berkshire Environmental Action Team. Incidents at this time were taken very seriously, and the quick response from DEP allowed for the collection of water samples to determine and toxic concerns or hazards to humans. As the Hoosic passes through Adams into North Adams, Williamstown, and Vermont, in New York, eventually meeting with the Hudson, sampling will continue and agencies will continue to work collaboratively with specialty minerals to resolve this issue and provide any updates regarding environmental impact. As of this afternoon, Town Administrator Green and Malia Decino of the North Berkshire RAPC met with the Director of Environmental Health and Safety for Specialty Minerals and received an update about the initial and ongoing operations. As a result, they're satisfied with the response from SMI, and know they are working closely with the DEP, Town of Adams, and Northern Berkshire RAPC, along with our Northern Berkshire Regional Collaborative Team, will continue to monitor the situation, provide updates, and support SMI during this time. So that is the whole statement. Now, on to the published agenda. Procedure for reviewing the emergency orders issued by Officer Blaisdell on Monday on workplace safety standards. I will conduct this review in 3 parts. First, I will present my weekly COVID report with additional commentary regarding concerns that have been raised since the orders were issued. Second, the board will review and decide on the validity of the emergency orders. Our options are to uphold, modify, rescind, or postpone to a future meeting. Finally, when we open the public comment period, we will ask that those concerned with the emergency orders speak first. I'll lay out ground rules at that time, as this is a public meeting rather than a public hearing. I will aim to keep the comment period focused and brief. Should anyone object, when I move on to our next agenda item, they may request a public hearing as noted in the emergency orders. The COVID report coming up. Now this is, I should say, is largely on our website, so I'm going to try to move through it as expeditiously as possible. Well, we do have a burning from online. This is what the update that I posted on Monday. As you can see, it's number 5 and advanced to one of my weekly messages because the number of cases have gone up, not only in Berkshire County, but in Adams. I call this a high alert, basically meaning we should be wearing masks in public as well as getting vaccinated and so on. More on that later. And I also have this note about the Board of Health emergency orders, which we will discuss shortly. I will, as you know, the children's pediatric vaccine is available. We had a clinic for our elementary school, Cheshire Adams Elementary School children. It was held at the middle high school in Cheshire on Monday, And you can see there at the bottom that 90 of the 461 eligible children were vaccinated. I was wondering, I learned earlier today, so that's less than 20%. However, it turns out that Northern Berkshire Pediatrics has been vaccinating kids like crazy, 600. So a lot of those children that did not show up at the clinic were vaccinated by their pediatrician. So, so this is good news. And these were just the numbers. I won't go, because I have we've been keeping track of how many people contracting COVID have been vaccinated. So more on that later. Yes, there were 2 more deaths in Berkshire County. So this is actually before that. I think we're at 330. And I've just been doing this calculation. It seems grim, but 1 out of 382 persons in the county have died of COVID, and that's just about the same proportion in Massachusetts. I do the Massachusetts numbers, and this was just the previous week. And then I've been running this since August 15th, mostly every other week until the state publishes these overlapping, but I've just done consecutive 2 weeks, except for at the end, and you can see the numbers go up and down. But I just want to draw your attention to the bottom line, the 10-day average incident rate. Massachusetts has been running, 20, give or take. They're now in this range. It was 18.2. The county, 32.7, which is the highest it's been, almost twice the state average. And Adams, over that 2-week range, is a little bit higher than the county. So it's a disturbing trend. But I do wish to note, you can see the numbers do go up and down, and just when numbers go down, it is not time to relax, because as you can see, they have been going up and down without these. I put together this extra slide, basically adding up all of the cases that I could attribute. Our nurse, our public health nurse, has been giving me weekly numbers. So they range in the beginning, for like this almost a month, but for the last 4 are weekly. So I looked at, and she gives me the cohorts by age range, and obviously children under 12 are not eligible to be vaccinated. And so there were total where vaccination status was known of 117. Those eligible for being vaccinated are 100, and that became sick, and 56 of those were vaccinated, which basically means that almost half of the individuals were not vaccinated. So essentially what this is looking like is that look down here at the lower left. Of those vaccinated individuals, only 1.3% have been infected, 0.4% hospitalized, and 0.1% have died. This was from the Department of Public Health webinar yesterday. And so if you are vaccinated, the chance of catching COVID is fairly low. But here in Adams, you can see that even vaccinated individuals are becoming infected. So the community spread is strong enough that the vaccination does not fully protect. I won't bother going on with the CTC here, and just emphasizing this. This is material from Dr. Dan Doyle, Berkshire Health Systems. This is, he provided this, there was a date here, just several days ago, but because of this, when this was put together by Berkshire Health Systems, there were 14 inpatients in the hospital, a 50-50 split among inpatients. And so what really struck me was the average age of the unvaccinated was 57. Partly that makes sense because us oldsters are actually pretty high up there in the rate of being vaccinated. But the vaccinated individuals, the average age was 73. These tend to be the frailer of us and possibly with comorbidities, pointing out that, but however, on the good side, you'll see the length of stay was half as long, 4.5 days for these oldsters than it is for the younger unvaccinated people. So the 73 here, these vaccinated oldsters, this could be your Uncle Joe, your Aunt Ethel. And so if you're not vaccinated, I really strongly encourage you to get vaccinated. Lower your chance of transmitting this disease to someone who is unable to withstand anything else that okay. So into our first agenda item here. The emergency orders, you have all had a chance to see them. They were on our website. I have a few comments and suggestions myself, but I would like to hear from Attorney, well, actually, I would like Attorney St. John, who has reviewed them before I hear from the board members. You have seen these orders, and I know you had concerns, mostly in terms of what is mandate, what is not, and the penalty structure should only apply to the mandates. Is that characterized?
Well, let me say what I think and see if that meets up with what you say. So when I reviewed the order, and I wrote to each of the board members separately, but basically the same thing. Much of the order uses the wording encourage or strongly encourage. That type of language is not mandatory language, and it's unenforceable language such that if somebody, first of all, how do you determine what is encouraging? How do you measure strong encouragement, strongly encouraged? That's something, that type of language you would probably regard it as unconstitutionally vague language because it doesn't really provide what somebody is supposed to do other than to, put in vague terms, we would like you to do something. So there's a section of the emergency order that provides penalties if you don't follow, the order or the mandates of the order, if you will. And I don't feel that those penalties should even be used with respect to that type of language. I passed those thoughts on to Mark, and Mark raised to my attention, and I think he's correct that there are a couple of things in the emergency order that are mandatory. And those items are, if I can just pull it up,
The reporting to the Board of Health.
the reporting to the Board of Health that there's a positive test, and that after the discovery of a positive test, that there be cleaning and sanitizing. I agree that those are mandatory. And I think if the order is changed such that if there's a penalty to be applied, that it apply to those two circumstances, only those two circumstances, and it doesn't right now. But I think the wording can be such that it does apply to those circumstances, that I think we can find. I just want to reiterate something too. I'm not trying to nitpick here on something. I want to make sure that something like this, if I'm called upon to defend the Board of Health or the town of Adams, that I have something that is defendable. And I think it's defendable if we follow those type of guidelines. I also want to indicate that the board has the authority under Chapter 111, Section 30 and 31 to enact this type of order. And I don't question the board's authority because I think that you make out the case, Dr. Rhodes, on the screen as far as your PowerPoint with respect to the uptick in COVID cases and the need for it. So I want to be clear about that as well. So that's my take on the order.
Thank you. So I should say, as a matter of preface, which I should have said before, the reason for this order is actually the reporting requirement, because at the end of the emergency, enterprises are not required to report cases to the boards of health. But now that we have this uptick, we do feel we have a need, because it really helps us with the tracing of contacts and being able to get ahead of if we know someone is positive, that we catch that person, quarantine, isolate, quarantine contacts as necessary, and so forth. So the rationale is basically information for us to reduce the spread of COVID. So having said that, Pete, Joyce, any further thoughts before we sort of go down line by line on the
I guess, I'm looking, I've seen the numbers and I've been on some of the calls with the agencies and public health nurse. And what I keep hearing from them is our numbers are high because it's within a household and spreading throughout a household. So I guess my question is, what is this doing to help that situation? In my mind, it's not. If that's the issue within households, then I don't think this order is helping them at all.
The other half of the spread is within within particular businesses that it's in the household.
That's not what was said today. What was said today is that the children are bringing it home and then giving it to the unvaccinated parents.
And
the children are getting it at school, not at businesses. That's what was said today.
but we have also had events with a number of individuals. I think that's probably one, perhaps Mark can speak to this, because he knows of not just household spread, but spread from events. Am I correct?
Events in business.
So it isn't just households, it is also events and businesses. And again, if someone is infected in a business and goes home and infects a child or whatever, it can go both ways. I would certainly.
I think the thing in the back of my mind is that we're coming into the holiday season, and I think that regardless of whether we have COVID around, people are going to start with the gatherings at these kinds of locations. I mean, that's the one thing I'm thinking about. If it was the middle of the summer, it'd be one thing, but it's coming into a closed building, holiday season, where people are going to be definitely trying to do some of the normal things that we did before COVID, which was holiday get-togethers and those kinds of things. And I know that they're really popular amongst.
Right, exactly. And so the sooner we find out who's positive and who the contacts might be, the easier it is to make sure that a potentially infected person does do the quarantine. Isolation is when you are a positive case and you are required to stay home. Quarantine refers to someone who has been exposed and is supposed to also stay home or at least minimize contact with other individuals. So you are assured that you have not contracted the disease, in this case, COVID. And so I know these are onerous things. You don't want to have to sit at home just because you were exposed, but that's basically what keeps the spread low. Yeah, that was on my, I skipped over that. Contact tracing provided by the state is ending in, what's today? So, yeah, I thought it was actually today, the 17th, anyhow. They're taking no new contact tracers, taking no new cases. And they expect to finish reporting as of the end of December. December 17th. Right, and so the any help we've been getting, the contact tracing basically falls on our public health nurse and to some degree, Mark, who has been, I don't want to use, has been very active, energetic in following up on these cases, and I really appreciate his dedication on that score. So I guess if we have this order sitting here, we can amend it, right, Attorney St. John, and then repost it as the amended order. With what I see, the main thing is your recommendation that we align the penalties with the actual mandates.
Right.
Okay. No, I'm sorry. This is, you came in late. I laid out the ground rules. You may speak in public comment. So please be patient. Thank you. You're welcome. So do either you have specific comments, or should we just go through line by line, basically? And I just had a few, simple in section 1, actually section 2, I think you deal with the federal. So, does this apply to the post office? Can it? under the understanding that the post office,
The states will be, said it could.
well, the state does say that we do have authority to require that they, and obviously the Pittsfield situation is a case in point why this is important. Okay. Then, we do address that municipal buildings are also included. I'm going down here to section 3, masking and social distancing. Post clearly visible signage regarding these policies. Do we have signs available or examples available? Where can we look for them?
Yes.
Yes. Okay, so these are these signs that we have from, so we do have signs available. There are many examples on the web and contact me if you need. Okay. I am now looking at staffing and operations.
Here, can I back up? Those, under section 3.
Yeah.
The first 2 bullet points are strongly encouraged, and then the next one is established. There's no encourage there, so that's a must do. And then post signage, that's a must do as well, because everything else is encouraged except those 2. So that looks like mandates.
Yeah, okay, so we should start those all with strongly encourage. Is that okay? It's simple to do. And then hygiene protocols, strongly encourage practice, best hygiene practices. Just up front, so that it's where you're just spelling out what best hygiene practices are. And I was looking at the staffing and operations instead of just encourage vaccination, strongly encourage vaccinations.
We strongly encourage. At the very top.
Yes, yeah. Okay. That would be great. Under facility should screen workers, second open bullet point, through the inherent 3. The second line. So you can see I actually read the whole thing carefully. And then we do have our 2 mandates. The one in section 6, the last bullet point is, and what's the best way to indicate that this is mandated? Must shut down.
Writing in here specifically that business establishment shall,
Yeah,
in the event of classification.
right.
Site.
And the notifications, that's the last bullet point, which does actually have a shall in it. How do we distinguish under section 8 the non-criminal disposition with whoever violates any provision?
The same requirement that being ordered by the Board of Health and
The cleaning,
those 2 sections alone.
right?
You could start off that section B by saying in the event of a violation of words to that effect, in the event of a positive case of violation, not notify, not shutting down and disinfecting, or in the event of failure to notify Board of Health, then these penalties shall apply.
Perfect.
And I can write something up for you.
That'd be great, thank you. And the 21D ticketing, do I remember that the subsequent is 300 and not 200? By law? Or can we say what we want?
You said.
Okay. Okay, so then, as long as that passes muster, I'm fine with that. Pete, Joyce, any other thoughts? We act. May I have a motion to accept these emergency orders as so revised in our discussion?
So,
Sorry.
Any further discussion? All those in favor, Joyce? Pete?
Yes.
Dave? Yes. We unanimously approve these orders as so. Thank you very much. Bill.
Say,
Now,
How can you do
how
that?
can you vote before the people talk?
You can't do that.
Do public comment after you vote?
gentlemen, you are out of order. I am.
Oh, we can't say nothing, you can run your mouth and keep on ours, okay. I get it.
I guess it would seem to me like you would vote, you would hear how the people in the town feel before you vote on something.
That makes no sense whatsoever.
You are out of order. And
But it seems like you did your thing out of order.
How can that even be? How can you vote without even just asking our opinions or what? What are we here for? Just listen to you say, yes, you're gonna do what you want? That's it?
we are the experts. And you have recourse. And I am going to ask you, if you cannot keep quiet, please remove yourself.
That's real nice. You're a great piece of work. That's bullshit.
Anyone else? All right. I am going to open the floor for public comment. May I have a show of hands, how many people would like to speak? I see one. Just to know, thank you. May I ask in the interest of time that we limit
Well, then what are we doing?
your comments to 5 minutes? I believe I've addressed some of your concerns. We may be able to address others, but I'd just like to hear what you have to say, and then if you still have objection, you have a right to call for a public hearing on this. We would be more than happy to accommodate. So please comment.
Okay, first, I'll compact it because some of what was said today answers some of my questions. I still have more questions, but I think I'm gonna have to see the actual revised emergency order and how it's written up to know for certain what my key concerns still are. it's a little vague the way it's been put together right now. One thing in particular that I question is the way that this was gone about. That an emergency order was issued, and it's issued under chapter 111, subsection 30. And an emergency order, one would assume that there's some particular emergency that has arisen that needs to be addressed immediately before the Board of Health can meet and act. Further, the action by the Board of Health agent must be reasonably directed or limited to address the emergency until the Board of Health can meet. And I would think of an emergency order as something to close an unsafe building. It had to be done right then and there. This order was issued on Monday with a hearing today. I still don't understand the urgency that it couldn't wait to be discussed and enacted today versus Monday. I guess I still don't understand the pure sense of emergency for this to be an emergency order. I saw the statistics that you put up, and yes, I see where they've gone up, but I also noticed that they went down the last 2 weeks. I also just want to stress one thing. And first, maybe you can answer a question for me. Are health providers required to notify of positive cases?
You mean a physician that?
Yeah.
Yes.
Okay. So if they're doing that, why does it become on the owner of a business to be responsible to do that? And with penalties incurred. I guess I don't understand why does the business owner have to turn into the state police?
I think I shall answer that.
Okay,
Because one of your questions was, why is November 2021 different from November 2020? And in some ways, they are the same because we have pervasive COVID. But in another sense, the Delta virus spreads much more rapidly, the titers are higher. That's not apparently cause a more severe disease than the earlier strain, but it is more highly transmissible. And as such, we are the response to that is how do we prevent gatherings or close associations that do facilitate the spread of the Delta COVID. So yes, I have been very frustrated and alarmed at the number of COVID cases. To me, this is actually a small request because during the emergency, businesses were required to report to us. So we as a town, we are allowed to say, yes, we perceive this as an emergency, same way the state did for the whole state last year. And you saw the last entry there that, you know, Adams, we have a higher rate than the county. The county has a higher rate than the state.
So there's, let me just jump in here, Dave. So when a physician reports, they don't give us a call. It goes and gets reported into an electronic system, the Maven system. So we don't have direct access to that, or public health nurse does. So it would be quicker for a business owner. Like if an employee calls in and says, I tested positive, I'm not coming in today. That would be a quicker notification on us if that happens. The other thing is there's a lot of home tests being done. And that is not being overseen by a physician, not reported anywhere. So an employee or a, you know, they can say that they tested positive on a home test. And then, you know, that's not reported by anybody. So that would be another reason.
I understand that, but I also understand the mentality that may go along with some of these people that are doing these home tests. Once they know and they don't want to be narked out by their employer, they're not going to tell their employer. And then what? And you can't ask them. You cannot ask them.
But we're not asking you to do that. We are asking you that if a employee says, well, you officers, I can't come in, if they don't tell you that it's COVID, you have no responsibility there. I mean, we are counting on people, and basically people have been fairly compliant about if you have COVID, you care. And you don't want to infect others. And so we're counting on that. Now, we're not asking you to ask for a doctor's note. We're asking you that if you know of an employee who has COVID, you let us know so we can do the contact tracing sooner rather than later. Does that make sense?
So by contacting the Board of Health, does the Board of Health do the contact tracing, or does it go through? I thought I heard you say that the state was shutting down their contact tracing. Did I mishear that?
They were providing assistance. The way the public health nursing system works is that the public health nurse monitors infectious diseases. So every 3 months, we get a report of the infectious diseases, and here of late, 80–90% are COVID, as you might expect. Flu's down, other stuff is down just because people have been masking and so on. But her job is to follow up with any of these infectious cases to make sure, you know, particularly if, for instance, it's a food poisoning. She would coordinate with Officer Blaisdell to track it down, make sure the restaurant or whatever, there's not a spread or limit the spread. It's what the public health nurse duty is to follow the diseases and kind of, whereas, well, we can only do that with the information. And as Member Hoyt said, if someone tests themselves, are they going to tell you? I don't know, but our hope is that they will, because they don't want.
I understand what you're saying, and in theory, most of the time that'll work, but there'll be a certain number of individuals that have done the right thing, have quarantined themselves and notified others around. But once they feel like they've outed themselves to someone that then has to make it public, that becomes a problem for them. And that's how they're going to look at it.
Well, it doesn't.
I just want you to understand how it happens is one thing.
We're not going to read it.
No, I know.
Let Officer Blaisdell
But
respond.
that's not how I understand what you're gonna say, but I just want you to understand that certain people, that's how they're gonna feel. They're gonna feel like they got the scarlet letter.
Maybe, yes, go ahead.
Okay, so that's not how it works. Okay, this is medical information, therefore it's protected. Very rarely do we ever get a person's name unless they're calling us, leaving a message. But even that case doesn't get disseminated out to the public. Okay, that's all protected information. During the state of emergency, we were getting notified of addresses. That was not public. The reason why that actually had to take an act of Congress for that, so to speak, was so that we could alert the first responders so they could take precautions if they were going to those specific addresses. But if you were to ask, file a public information request, we would not have to give you those addresses. Okay, we don't get those in. So the calls that Michelle and I get are people who have tested positive. The CTC is overburdened. They're dealing also now with, because they're ramping down a diminished workforce. So our public health nurse doesn't even get that contact tracing in a timely manner. And so even our public health nurse doesn't give us all the data on a timely basis. So that's why that we need to have that information sooner rather than later, so that we don't have a period of time lapse where there's going to be retransmittal cases. Okay, so the whole purpose is to continue, so for us to provide you with assistance, whatever assistance you need to manage your workforce, to ensure that your workforce doesn't go out into the community and infect others. So as we were talking about some other events, we did have a couple of cases of different types of events happening where that was exactly what was happening. Is they were going and retransmitting. By the time we got it, it was a week later. So we're now putting into a mandate that when you become aware of it, you notify us. We're not going to ask you the employee's name.
All right, that's very important, and that was going to be my next question. If you could walk me through exactly what information you're going to be asking for.
Yeah, so you're going to call us if you have COVID positive. As a matter of fact, when I was hand delivering the orders, I had one visit said, "Oh, glad you're here because I just had one." And okay, so what have you done so far? Well, I got 2 people who were exposed to that individual, and what you told them to do. They're going to go get tested. They're not coming into work until they have a negative. So okay, great. So what's your next step? Well, we're going to do a cleaning. How do you advise them? A big place. So how would you advise them that to happen? So I advise them how to do that more thing. So so that's
That's very key and important. And I would just suggest that bit of information somehow be disseminated to the businesses. I think it's really important to let everyone know what the whole protocol is, what the steps are that are going to be taken, and what is exactly expected of the business.
Mhm.
I think it would be very, very helpful.
okay.
So
Yeah, so that's not a problem. I mean, it's not something new that is hit our community. It's been in place for quite a while, and throughout the state of emergency, we did have businesses calling us because they weren't getting contacted by contact tracers, and our public health nurse was inundated, and she wasn't even getting a hold of them. So their 10 days would come, and they haven't heard from anyone. You know, so when we get those types of things, we're calling our public health nurse, you know, to confirm one, that they're on our list. And another thing I want to mention is this is not just related to Adams. Okay, you have Adams residents working elsewhere, and you have other residents coming to Adams. So it's more in line with the town officials, and they are isolated solely. within
Okay, so let me give you an example. If we have an employee that lives in Springfield and is working in Springfield, do we need to report that to you?
That goes to Springfield.
Well, she's asking about according to our order.
Or your emergency order? How does that roll?
That's
Because that's the
So-
kind of
so
scenario
my-
that can
so-
happen at Adams Point.
right, and so, Mark, I've got a case where my employee lives in Springfield, he only works in Springfield. Okay, so I just log it as, all right, you notified us. And let me know. He's never come here, you have to do a cleaning of the shop, he's never met up with another employee, and they've ridden together, so he doesn't have to clean his truck. So his truck. And you have, yeah, just call.
So again, my suggestion, it probably doesn't make sense for it to be part of the emergency order, but maybe as an appendix A or something.
A cover letter.
Something to just
Yeah.
lay it out for businesses in the town of Adams. I think that would be extremely beneficial for everyone involved.
What is this reporting requirement? Yeah, basically.
Right, but we're not only talking about businesses that are based here. Del Molino's, for example, they're based in Cheshire, but they perform. Okay, so we don't want them having an infected employee working here. Okay, so if they're performing services here in the town of Adams, we want to know about it. We want to make sure that they're implementing the proper protocols to keep them themselves safe, but you.
That sounds great in theory, but man, that sounds like that's gonna be a possible task.
Again, we've been.
How many businesses
We've
come
been
through this
dealing
town
with it
and to work
a
in
year
this
and a
town?
half, and vast majority of the businesses aren't not cooperating. They are. I would say you are.
And any little bit helps in having the spread. I mean, if it's 50%, I mean, it's, story about vaccination, we don't all have to be vaccinated, just enough of it to slow the spread. And it's the same way here, is that you have, if you can stop the spread among 70% of infected people, that's a lot better than none of them. So I just, and it's, the thing that makes me sad about this, like you said, is that we have to have a penalty structure. Because to me, the reporting and the cleaning just make sense. And that's the problem with legislation, is that in order to make it happen, you have to institute penalties. Is that? I mean, in a perfect world, we would just say, it just makes sense, and everybody says yes.
Yeah. And during the state, we're going to say only issue one thing. That's it. One.
All right, well, I'll wait to see how this all gets written up, but I feel a lot better about it, honestly, because I just was very, very concerned that we were gonna have to be giving out names and that type of thing. And it turned, that can snowball and turn into a hot mess in our right.
Yeah, and we have that conversation with the businesses who call us, we tell them. Yeah, no, don't know the name, and probably will practicing not to re-mention. So if you just say we had a person that's positive, you guys are gonna talk among yourselves anyway. But we're not transmitting anything.
Right, thank you.
But I wish to thank you
Thank you.
for helping to clarify. Because when we sit up here, we sort of think what we say makes sense. And what you're saying is that it does make sense, but give us a fuller perspective, and I appreciate you helping us do that. Any other public comments before I close the floor? Floor is now closed to public comment. Thank you all. I think the next item here is approval of minutes, September 29, October 9. I did review them. I don't have any changes. So,
I do. I have clarification.
okay, good.
No, it's shocking. But I have.
Yes,
we're doing September 29th first, correct?
Yeah.
Okay. On page 2, under 8 Valley Street, is it Casella or Cosella? It's Kocella, right?
oh, Scott.
Yeah. I mean, I went back and checked the order, and I think that it was spelled Koccela. So that appears twice.
Yeah, I had Casella always on mine. How do you spell it? K-O.
Koccela. Yeah, it looks like that's the only one.
Yeah. And so, do I have a
Motion to approve September 29th Board of Health minutes.
Joyce, what do you say?
Yes.
Pete?
Yes.
Dave, yes, absolutely unanimously. And as for October 20. Anything there?
I do.
Go for it.
Okay, on page 2, under new business, the sentence, the photos shared are shows at the house.
Where are we? Which paragraph?
Under 80 Friend Street,
Mhm,
the second paragraph,
mhm.
maybe I just didn't understand the sentence. The photos shared are shows at the house. Photos shared show that the house is around.
Shown.
Photos.
I'm not even seeing the photos.
You have 80 Friend, and then you have Dr. Hoyt,
Yeah,
and then, yeah, the second.
okay.
There's
There's
a-
a share.
Take out.
Oh, maybe take out
Yeah.
R.
Yeah.
Okay.
And then down at the bottom under the cannabis tab. Vaping, so Ms. Brewer can have a voice in the subject. Ms. Brewer felt that the information should be educational and proactive. Just insert felt.
That, say that again?
Mrs. Brewer felt that the information should be educational and proactive. Yeah. And then the last sentence, Ms. Brewer said that there is an obligation to do community youth prevention education. Do training.
Okay.
Yeah. That's all.
Motion to approve October 20th Board of Health minutes as amended.
Second.
No further discussion. Joyce?
Yes.
Pete?
Yes.
Dave? Yes. It passed unanimously. Thank you. We are up to date. Law enforcement officer have reported, well, enough already. Went to rest. Old, moving on to old business. We have Mr. Donis here, and we have an update.
Yes, I was there today. So he's still progress. But elaborate on that, and I'll
Okay.
discussing getting the 2 trees in the backyard. And the front porch floorboard, carpenter down there for a little while, we replaced the front porch floorboards there. And there were some problems with the side porch, there was some rotted out. Being in the front, crossing into the porch, carrying beam down, the whole side is rotted out, about halfway down, less than halfway down the porch. So we're gonna replace those sections. And then the floor joist, which is over near the outside of the porch floor area, that's gotta be replaced. And then I've got those brand new, under roof, old floorboards that I pre-stained all the new ones, way ahead of time. We're gonna install, starting from the, well, we're gonna have to remove some of the old floorboards back down to where that middle post is. We're gonna replace the side of that beam there. And then we're gonna reuse all of those boards that are solid and sound. And he's gonna put in brand new ones, pre-stained ones, and pre-stained out to the front end. So the side porch is not completed just yet.
Sounds like nothing.
Stuff getting contractors in.
Right, and just to wrap it up, I would ask that work still has to be done on the season. This is all outside. Things that he's done so far have been satisfactory. We're not going to escalate over the year. And I would ask that it just come off the Board of Health review and follow up.
I will miss you.
You missed me. I'm sorry to get the meeting last month. We had not to one.
You're welcome back anytime.
We're here.
Thank you.
It's amazing that it's kind of like, almost like a physical way with lifted office when they finally got that tree off the back of the house. And one that dead elm tree too. But yeah, you don't think about it because you kind of try to put it out of your mind for a while. But it was just like something that just lifted off us mentally, physically almost.
Well, great. Well, glad we could be part of that. So, yeah.
You call these tree service people, or especially any contractor. A lot of them don't have anybody there at the house. I didn't know they're out in the field working. And they've got very few people. They can't even big enough to prove work anyway. So they're out there working their tails off themselves. And voicemail says, "Oh, box is full." You can't even contact them anyway at all. So, I got lucky to go on the tree service. They were the first year, 3 people on his crew still working with them. Son-in-law, grandson, and another guy.
Well,
they get those trees out of here.
Thank you so much. I can't wait to drive by and take a look. So you take care. And so we have this I put Discover books next. There is an update. I attended Board of Selectmen workshop last week. I presented the information on Discover books donation box again for them for their advisement. And there were 2 issues. The one that remains is traffic flow at the transfer station. And one of the selectmen asked about the security of the box. So we will take a look at the transfer station when, and usually can be time. District manager, DPW, myself, and Ray, PA Green, if he so wishes, take a look and see capability. And as far as the security, the regional manager said that they have over 500 boxes in both the secure places like transfer stations, attended transfer stations, and public, and not one of them has been broken into. So it appears that whatever they're doing, the boxes are not being stolen from or vandalized. It's going to be the first. So that's that. I'll update you once you get more information to the board of selectmen. 76D Allen Avenue condemnation.
Owner still has not done anything to repair the conditions. Occupant is still in residence there. The Berkshire County Regional Housing Authority is asking to accompany the resident and housing board. Right? So I made an inquiry of the housing board when that happened, and they suggested December 8th.
Good. Thank you. Was that the one on the corner of the Newark? Yeah. All right, 25C Pleasant Street.
Landlord has made efforts to access, and allowed access. And that's between them.
And so we say,
So I. Correction order still exists. Or not implementing. Or action. Or that remediation. And file a complaint. Or something.
so does that stay on?
You can take it off, actually. Unless you want to keep it on.
Right. Okay, yeah, so the, how will that have back once you have, if there's something you need to bring back to it, okay, sure. So that will be all. 80 Brent Street.
80 Brent Street, I did, after the board made their declaration, I did issue a condemnation order for 4 parties to be served. I've gotten the green cards back from 3, 1 remains out there. And in any event, the condemnation order stays, never expires. If we so choose to advance it to more demolish, that would happen after a year, or unless some part of the structure collapse in the meantime. All that notwithstanding, so it's not my intention to issue any fines because they bear about the property. So go away. So, again, that doesn't have to stay on.
Okay,
Continue with 13 taxes.
Actually, they are.
okay, moving on to new business. First item I have here, actually started out as the concern that Mark was not, we have not designated Mark as our health agent. And with many, discussions among Attorney St. John, DA Green, and Blaisdell, we looked at the job description for when Mark was hired in October 2019. 3 pages is very complete. It actually covers all of the authorities that he needs to act as the Board of Health agent. I hear that with other board members here, they had a chance to review it. And so basically, what I would like to do now is acknowledge what I just said. The word that TA Green suggested I use is that we, as the board, ratify the job description as suiting, as fitting our needs for having a health agent. So I would like to move that the job description for code enforcement officer be ratified by this board.
So,
We have
second.
second, so discussion,
So, yeah, so how is this? What are we doing different than what we did in a joint meeting for the selectmen back in Mark's hired?
But they was just sort of put in front of us, and I think, you know, I stuck around, you left. And and the select board approved. In fact, I don't even think I was there at the selectmen's meeting. It was basically, it was on their agenda, not on our joint. On our joint, the joint agenda was to appoint Laura Grandchamp as member.
I remember being at a select board meeting when Mark was hired.
When I was ratified,
Yeah, I believe so.
so I'm
Am I wrong? I don't know, Jay.
so I'm not being
Am I
ratified.
wrong?
Board of Health does no personnel
This has nothing to do with Mark. This has to do with a job description that was created, actually by,
Okay.
head of inspectional services now, what's he called? What's Jerry called?
Let me be very clear.
Yeah.
Nothing has changed since October of 2019, when Mark was hired. In fact, the position code enforcement officer has been on the books quite some time, before I was town administrator. When Tom retired, the previous code enforcement officer, Jerry Garner, who was director of inspectional services, he is the department head. Mark is not a department head. Jerry is. He has, according to our charter, financial, fiscal control over the budget, and he has personnel control over the department. Jerry was instructed by me, update the job description for code enforcement officer, so it's comprehensive. We already had an idea of what we wanted the code enforcement officer to do. He did that. Turns out Mark had provided Jerry some guidance anyway, because they worked together previously in Pittsfield. So it's incredibly comprehensive. That process came back to me. Personnel manual allows the town administrator to just take it and act on it. Town administrator's personnel authority, town matters. However, what we did was in this situation, Mark works very carefully with the Board of Health. At the time, Dr. Hoyt was the chairman. So myself and Jerry being the hiring authority as a department head, myself being the town administrator, we invited Dr. Hoyt as the third member of the interview panel and said, come on in. So Pete participated in that process. We had two candidates. Mark was chosen. But at some point, and I don't remember when, I'm assuming it was probably before we did the interviews for the position, that job description was presented to the Board of Selectmen just for their ratification as well. They're not required to do it, but it's just good form to give it to them, say these are gonna be the functions of this employee, so everybody knows why we have the employee pay. So that was the process. However, the personnel manual does say, or I should say, our bylaws for special acts say that when the town administrator makes a hire, it's good form to put them in front of the select board and ratify. So what it may have been a meeting where we were appointing somebody else, or for some reason we had a joint meeting that night. I don't remember. We had several. It just so happens that the night Mark was also ratified. So that's probably what the process was. So there's been no structural change. There has been no job description change. Has there been confusion over Mark's role and under what authority? Yep, we've clarified some of that. Ed and I have met with Mark. Mark comes in periodically. Hey, what do you think about this? Works carefully with David. There's always some of that confusion, but Mark is essentially your contact as full-time town staff to be able to handle Board of Health. You three are not going to go out and look at it. It's just not practical anymore, the way that we are structured. That's why we have a code enforcement officer. There's things that he can do on his own as a code enforcement officer, and there's things like tonight that he did that needs ratification. So that's essentially how it works. However, in the structure, in the chain of command, Mark reports to the director of inspectional services, just like the electrical inspector, plumbing inspector, gas inspector. All of those positions within town government have something to do with permitting. The difference is Board of Health's busy, so it's a full-time position. Mr. Garner, if you remember, used to be here on a regular basis. His duties have expanded over time I relieved him of that duty. Mark is up to speed and can certainly handle what's going on. So that's a snapshot as to how it worked. David's concern that he brought to my attention was he felt that he had no say in hiring Mark. I disagree with that. We participated in the interviews. We had a good conversation about it. There were only 2 people interviewed again. Dr. Rose believed that the board should have a say in the job description. I disagree with him there, but there's absolutely no harm in having the Board of Health review the job description. So frankly, you understand what the duties are of the code enforcement officer. That's perfectly reasonable. I'm just very careful not to dilute or change tenets of what the special acts in our charters require. 1983, 1984, and we were just talking about this the other day, town government functions and powers were distributed all throughout different departments, and we were an ineffective community. We look at the notes as to why the charter was modified in 83, 84 to a centralized town administrative government. We're talking again about reviewing those special acts and modernizing. Don't want to go back to something that we were doing in the late 70s or early 80s that were ineffective. So I just want to be sure it's very clear as to what that process is, etc. But Mark is your point of contact for what you need to do to effectuate your duties granted to you by state law. No different than he did for me when I sat as chairman of the district board of health. I couldn't go up and approve his days off. I couldn't tell him when to work. I couldn't do all that. But I could certainly make recommendations to him. You know, Mark may go out and look into the building. Please do X, Y, Z. Please let us know your opinion, etc. That's how we're structured. I hope that certainly helps as a refresher. It's certainly good to refresh that from time to time. I think that job description is pretty comprehensive.
It is.
As Mark and I, we were chatting the other day when he was hired, it was his opinion that he was asked to be an aggressive code enforcement officer. We know that we have light. David, you've been on the board for a while. Joyce, you're coming up to speed now on some of our issues. We had that. Mark has a comprehensive knowledge as to what's asked of him. And we're busy. So certainly that answered your questions. And,
Yes, thank you. And I do want to say just, the process of hiring Mark, I couldn't talk to you without a public meeting. So without, and we couldn't do that because we didn't want the process to be a public interview process like the other things. So I that's the reason why I couldn't relay any information to you, Dave. I wasn't trying to exclude you. I just can't because of open meeting. And I'm sure Mark didn't want to be interviewed on a public stage. So
having gone through it, I don't think anybody wants
that. So that, I think that's the reason. And also I think we got the right person. So
there may not have been a public meeting in between here. So it is, I guess that's the thing about conveying information versus deliberation. Like, actually Michelle was the first one to do it. I was within 5 minutes of emailing the DEP notice the day when you set it out. But I wanted to inform you to. So there's no deliberation. It was just like, this is happening. So you don't need the open meeting, but you can say, I said I was going to the emergency meeting. So it's basically information, right?
The purpose of the open meeting law is to prohibit deliberation and decision without a public forum. If last night, when I received notification from DEP, I sent it, as you may or may not have seen, it was late, so I don't remember exactly if I used VCC or 2. But my goal in that was to disseminate the information contained in the DEP email to all relevant members, Board of Selectmen, Board of Health, Mark, a few other people. You're not going to respond. There's nothing in there that allows you to deliberate or decide. It's information. If you go back and forth and say, well, you know what, Mark and I talked today, I like his green sweater and he likes mine, so we're going to work. That's decision, that's deliberation. You can't do that. As long as you guide yourself accordingly, and Attorney St. John is we've had these conversations with Mark too. He has to make the determinations about open meeting law violations and how things should be conducted because he has to defend it. But if you always keep that in your mind, information dissemination is far different from deliberate and decide. If Dr. Hoyt wants to say, please put this on the agenda for next meeting, he sends that to the three of you, that's fine. If Pete says, hey, I stopped in and I talked to Jay today, he brought me up to speed on DEP, where you did that, that's information dissemination, it's not an issue. I find sometimes that the open meeting law actually hampers the open meeting process.
Yes.
Because it shows communication, and that's not its intent. So you have to really understand what the intent of that open meeting law is, and that's always deliberate and decide. And when in doubt, don't respond, or as Ed did, he emailed all of you independently. Let me speak there,
No, it's
Thank you.
perfect.
I hope that helps.
It does. Thank you. So I think we have a motion on the floor. We have any further discussion? Joyce?
Yes.
Pete? Yes. Dave, yes, unanimously ratifying the job description for code enforcement officer. You were, so,
You can go back to work.
yeah. He is working.
He's on overtime too.
That's what it says in the job description.
That's what it is. It is what it is.
Work with the Board of Health, so we're working. Okay, thank you. Moving on to, this is Mark working. So, Mark, I read over what last meeting, the FDA, AFDO, food grant and charity. And it looked to me that there were two, basically, two thrusts, one of which applied to you and your training, and the other which applied us and training you, training for inspections and so forth, and us just for background knowledge. And I noticed also that Adam is sort of ramped up there as there are 3 steps, there involved in coolest towns down at the bottom. There are the developing towns, which we are, and there's full blown. They have all the inspectional wherewithal to do. So.
All right, so the biggest aspect I think is the foodborne illness. Right? So you've got your inspector who's going out there doing routine things. A lot of times it's going to require some education, especially when you're open. You guys are the appeal process. Also, you're going to be involved if there's going to be foodborne illness, right? So that's why you need to be informed as far as what your responsibilities are, what actions I can take in the field, and then what actions I bring to you. So that's all in a nutshell. The food code itself has evolved. So now it's merged with the federal food code, which is undergoing revision. So at one point, it's all going to be one code. All right. So you'll be given, well, you should anyway, by the inspector, whatever he or she cites and presents to the board, so you make a decision on that, but you've got the oversight for any of these food code matters, which includes permitting as well. So you have some people that say, why is he requiring a temporary permit from me? So because it's all based on safety.
Right.
So again, with regard to permits, you could have someone appear before you and say, I have submitted my application 6 months ago and I haven't heard from you. So you say, decision based on presentation.
So there are training, the grant gives youth training opportunities.
Yes. Yeah, because right now, all an inspector has to do, qualified inspector, who call inspector, is complete the service safety course, service safety management course, and the allergen awareness course. That's it. That's all code requires for your food code inspector. So what, as I said, that the food code, the mass food code, all to merge. Okay, so when I started, it was just mass food code. And so now, it has merged with the federal food code, which is on 2 pages now.
That's the FDA, that's the FDA part.
And that's the merge.
Yeah, right.
Then it's going to evolve again. It's just going to be,
Okay, so we should sit down sometime and see where we are. You know, there was one, I think it's September course that so much has taken.
actually, Sabre has had 2. I signed up for both courses, but then I couldn't take either of the courses. Okay, so grant opportunities don't cost.
Right, exactly.
Okay, whereas otherwise. So what we were relying on were those annual conferences, which stopped last year. And they just offered one out on the Cape. It was, last week. So again, our budget is tight, so I mean, no,
Right.
so is the course itself. So see courses starting to be offered again.
And right, and you value yourself. And me too. And I think there are other, well, anyhow, so thank you. That's that we finally address this.
Yeah, and that's going to require the updates to like Current Eyes, Alliance. We share with 8 other communities. So all that's going to be updated, and then we're going to have to update our own forms.
Okay.
But, so that's where, you don't have municipalities synchronous.
Right.
Maybe.
Well, I've heard, but I think that's what the shared services grant is supposed to help us do to get us towns aligned to make that whole process.
Yeah, I mean, 3 Northern Berkshire Town, that is what happens in Williamstown. We're all using the programs.
Okay, well, thank you. Let's move on to cannabis webpage. So I sent around a very simple sheet with state law code and some pointers to information to look up cannabis enterprises. And Joyce, today, did you send it also? I didn't notice.
No, I think you just sent it.
It was it was to get outraged. So what I put together and then got diverted. So what I would like to do is to include that and encourage either of you to add additional resources, quitting or just awareness or whatever that we find. The only question is whether what I sent out is ready for prime time, or if I should wait until our next meeting to. Any thoughts?
Well, do we anticipate more? So Joyce, the thing that you sent, that was for an addiction resource?
That's
That would be
the
under there?
webpage from DPH for vaping and smoking cigarettes.
Okay.
Yeah, it's all, we just merged into under the mass.gov we were just recently district. So we merged, so there's a new link that people will automatically get redirected to, which provides information on vaping and tobacco use for schools, community, and parents.
Okay, well, let me take a closer look at that. I'll revise what's in the,
Yeah, I think that would be,
yeah, so that is good. 2023 budget considerations, the town charter. Okay, talk about the town charter. The Board of Health is actually supposed to do 120 days before town meeting propose a budget. Be sent to him, then goes through the board's selectmen and council. So we haven't been spending our budget in the way that it was designed years ago. So I would like to sit down with Mark, Jerry, if he's available, and just kind of look. The budget is going to be level funded, which is better than being cut. But make it more realistically align our needs and what we do. And so I would like to be able to do that over the next few weeks and see if we can come up with some numbers that fit within that 11,000 something or other. And you're more than welcome to kick in suggestions. And so see where it goes. I mean, the budget's been through a number of changes since I came. And the most recent change is the increase in public health nursing services, which is a much bigger fight for what we were, almost $1,000. And so I don't know if we're gonna have to pay more than that all year, but align the budget and practice. So I would, do you have any thoughts?
It's, I understand, you know, the answer on the funding. You're not going to get that code enforcement that you expect when you hire. You know, if I mean, the budget for code enforcement is kept at that 550. Because you're not going to get orders that are served in accordance with statute. You don't see the primary method of code enforcement like communication, verbal or text or email, which is not in accordance with statute. Might be by regular mail, regular and certified. That's required by statute. You'll have people living in them properties that you can't take to court. That one property up there, you have or summonses certified sheriff. So that's one decision. You don't have to. So just be conscientious that people approach you and your code enforcement guy's not doing his job. It's not right. You know that I'm out there and do everything to the extreme extent of it. I would have many problems. We have receiverships. So just keep that in mind. And that additional item I mentioned yesterday.
Yeah. Okay, so,
That limits.
yeah. And there is some hope that ARPA money will I'll get it used and give us a little boost in terms of, I don't know. Yeah, so I'm got my feelings out on that. Meeting frequency and length. Sometimes I feel as though we don't meet often enough, and obviously how we can get up. But longer, would it be feasible to be twice a month or try to keep it at an hour? Like first and third Wednesday. You have any thoughts?
Yeah, that brings us back to budget. So there's no overtime line item. So the longer the meeting is, the more frequent meetings we have. Change the cost. And Michelle's
Yeah.
money comes out of. What else?
I'm not sure where the overtime comes in for when I'm doing a Board of Health. I'm not sure where that comes from, but it's still considered overtime. I mean, there are thoughts and things that you could possibly do. I don't know if the 4 o'clock has to happen. Maybe if you push it to 3:30, that might help. If we ever have to run over. Because we work till 5 o'clock on Wednesdays. So that's possibly an option. My concern is if we do more frequency, it's still going to take away from my duties that I do for other departments because of the preparation, the time it takes to prepare for the meetings, not to mention the minutes that happen as well. So I don't know if the frequency is going to help on
Yeah.
my end at all.
Yeah, and Jay was. It was the overtime was significant enough burden for the town.
Well, understand, because of my situation, I prefer the comp time. Okay, but should I leave and you get a successor, they may want that. Okay, so. That's that. Still don't understand how. I don't think so.
So for the time being, feeling just keeping it same. Should be okay. That's fine by me.
Yeah, I'm fine with keeping it the same. I think sometimes we fall into the, if we're wanting to meet more often, sometimes it's we meet just to meet and not really to do something. We don't agree with just meeting to meet. You know,
But I think those times where we actually got us off schedule was because there were certain conditions where you have to meet within a specified period of time.
and
For example, if I issue that this emergency order
Last week,
last week,
yeah,
we're gonna meet within 2 days.
yeah,
Okay, so yeah, any of that
Yeah.
stuff.
And I think that
That's
can
what I-
happen if we do need to meet, and we can do that. The 3:30 is not gonna work for me. The 4 is actually pushing it for me. Because we work full time as well.
Right,
So,
I get it. No, I
yeah.
get it.
And I've been lucky working from home. Once I go back to work, then I have to leave at 3:15 to get here back to work.
all right, well, let's keep it at the back of your mind, but I'm okay with no change. At this point. So, okay, local and county updates, I did the Health Association Executive Committee that day, which is where I found out about the pediatric 600 vaccinations out in the school in 90. And else of importance, nothing I need to relay here. Tomorrow, we are the Health Alliance meeting, and again, there's people who letter to us. It's our 10th anniversary. And so 6 of us will actually go there in person and have cake. So I'm looking forward to having a nice dinner out and cake in celebration of the alliance, which is really, it's a great group of people. And they got $300,000 infused from, I think whether that was a shared services, I think that was shared services grant earlier. So I will report on that next meeting. Review mail. Linda Cernick she emailed all of us to say that we got RDP. I used to know what that meant. Like recycling something program, $4,900 for an acknowledgement of the work we have done with recycling and to help us increase that rate. And it's very good, very helpful. And then we got the letter from National Grid regarding their criticized program. The power line that runs up through what the power line landfill the quarry, so they spray on. Well, I think a few other places in town, but they just need to let us know. And other than that, is there any email that came in that
Nothing at all.
for the good of the order? And
Thanksgiving next week.
Have a good Thanksgiving.
Happy Thanksgiving.
thank you. That's right. Don't cook your turkey enough. So, and so the next meeting, do we want to aim for the 15th?
Big final exams that week. They take them fine.
But you don't have to study.
No, man. It'll be fine. Thank you.
You can stay up to 1 o'clock.
Oh, God.
I can't stay up there anymore.
Yeah, it's okay.
Yeah, it'll be fine.
Good.
Okay.
Final thing.
I do not have a final exam. Better that week anyway, because it's a holiday week, it's the following week. It's gonna be a short week.
We have.
Motion to adjourn.
Like I said, we have any discussion? No. Joyce?
Yes.
Steve?
Yes.
David? Yes. Okay, clock out, Mark.